Okay, hi, this is Dr. Sara Siddiqui, and I'm here to present to you this month's topic regarding recognizing depression and anxiety in your children. Um, Obviously, we've been seeing some increases in presentation of children presenting with anxiety and depression. It's helpful for parents, I think, to know a little bit more about it. And let's get started. Yeah, let's see, let me share my screen. There we go, and go in present mode. Okay, so hi, recognizing depression and anxiety in children. Thank you to the Elwood Public Library for suggesting this topic, and I'm happy to talk about it. It's a very important subject. So I have no disclosures to report. Of course, you want to discuss any specific issues with your child's healthcare provider or pediatrician, definitely be sure to keep in touch with them. We do offer a lot of resources, some of which I'll be going over today, but it's always very good to keep in touch with your pediatrician. So mental health and COVID-19. So as I shared before, it is something that we've been seeing more of, but obviously this is always, mental health issues in our children have been ongoing, and the COVID-19 pandemic are the results of all of the isolation and shutdown maneuvers. Changes in schools and social settings have increased some of the mental health issues that we're seeing in children. So some of the reasons, obviously, people are under a lot of stress, whether it be their jobs or health, changes in social situations, family members being sick, fear of the unknown, again, the disruption of activities, school, sports, some of the usual socializing mechanisms are not at play or slowly returning, but still not to the full norm levels yet. Not being able to see some of the supportive people in your family, grandparents, aunts, uncles. We haven't been visiting our parents and grandparents as often as we used to. And everyone has been suffering, but recently we have been seeing children and adolescents particularly being susceptible. We always like to think that children are resilient, and they are, but I think that it is important to remember that each child is different, and each child has different needs and things that they may require to help them. So it is, it's sometimes even younger children can present with symptoms or signs of stress. So you may not think that it might be related, but it might be related to signs of stress or anxiety. So in younger children, definitely, we've been seeing this since the beginning. They can present as being very irritable, definitely harder to calm down. They have changes in their appetite, either decreases or increases in appetite. They have sleepiness or difficulty sleeping or waking up frequently at night. If they were sleeping through the night, sometimes they are waking up now. They're more clingy or are anxious when you leave, or withdrawn. They're not as willing to maintain contact with you. They show increasing separation anxiety, whereas before you could drop them off to daycare or school or something like that. They are increasingly resistant to doing so. In the children that have already been trained, sometimes we see reversal or regressions in their toilet training habits or their training habits. They might return to bedwetting or even daytime incontinence or wetting. And sometimes they can be more angry or increased frustration, things that usually wouldn't have bothered them now do. And sometimes even, you know, talking about or obsessing about certain topics, illness, death, maybe some things that they've heard or seen, and they're using it in their play. So these are things that you want to keep an eye on and you know, discuss if you're seeing some of these. For older children, definitely mood changes, you know, feeling extremely sad or extremely happy, where where they're showing signs of inappropriate moods in a setting where maybe they are supposed to be morose. They kind of are maybe manifesting inappropriate behaviors during that time. Behavior changes where they are indifferent or not really interested in anything, particularly things that they used to be really interested in, they no longer want to do, definitely with sports or activities, or even hanging out with their friends. They were talking to some people and now they're not. I do try to talk to all the adolescents and older children that come to see me to make sure that they're still speaking with their friends. They have a circle of people that they've been talking to. Definitely parents, you want to be speaking with them, but they need to have like some friends or some socializing going on. The older children definitely changes in their sleep habits. So they used to sleep a lot, now they can't sleep, or they, you know, have difficulty falling asleep. They sleep too late in the day, maybe on the days off or on the weekends, they're sleeping much more. And definitely appetite changes. So this is something that we're really seeing a lot of. We're seeing different manifestations of eating disorders, eating too little or too much, binge eating, and this is very troubling to see in the older children population. Some of the other things that can present with older children, they're having difficulty concentrating, they're not interested in their schoolwork, they don't really feel like doing it. They were really good students, but now they just don't really care or don't want to be as involved. Changes in hygiene, so this is really important. Sometimes with the hybrid nature of school, where they don't have to go into school, they're just dressing the top half of their body for Zoom and things like that, or remote learning, but they're not really taking care of themselves to the extent that they used to. That is a change that could be concerning. And an increase in risky type behaviors. So as you know, and I've talked about before, adolescents and children, when their brains are developing, they don't have that frontal they don't have the full capacity to know that certain behaviors can cause them harm, or they feel like it's not going to hurt me or not going to affect me, and they may go ahead and do those behaviors. So sometimes an increase in those risky behaviors can occur when we're stressed, anxious, or depressed. And thoughts of death or suicide, which I will be covering a little bit later. They're kind of either talking about it a lot or kind of reading about it or discussing it. So this is something that you definitely want to talk about or monitor, or reach out to your pediatrician, or use some of the resources that are going to be later on in the presentation. So anxiety, I always try to tell parents that, you know, anxiety, there are normal types of anxiety that children can present with. We do respond to a little bit of anxiety. That's what makes us perform. That's what makes us finish our work. That's what makes us go to work, do what we are responsible for, complete the tasks that we're supposed to be completing. So anxiety is that little bit of inner pressure that you feel to make sure that you're doing the best that you can in the things that you need to get done. And anxiety can become a problem if it's stopping you from doing some of the things that you have to get done because you are worried about it. So it's an excessive type of worry. So, for example, reoccurring fears and worries about routine parts of daily life. So just maybe getting to school, you're worried that, or your child may be worried that something may happen on the way to school, something may happen to parents on the way to school, something on the bus could happen. So those kind of ideas that take over, and that's all you can think about, is something of something that you need to check out or monitor, because something that's persistent and ongoing like that is a manifestation or a symptom of anxiety that you need to treat. So physical complaints like stomach ache or headache, this is very, very common. We're seeing a lot of kids coming in presenting with headaches and stomach aches, and these need to be worked out to make sure that there's nothing else that's causing that, something else besides being anxious or worried. But sometimes when all else is ruled out, it could be from quite a bit of anxiety can present with physical symptoms. And it's not that they're making it up or they're just it's in their head. It's actually that they're feeling those symptoms and it's real. They have trouble concentrating because you can't focus on anything else besides what you're worried about. Obviously, trouble sleeping, so trouble falling asleep, because at the end of the day, as we all know, sometimes that's when your mind starts to think about all the things that you either have to do or have done. Sometimes we get caught up in that, and children do too. They get, their mind starts really circling, and it's hard for them to fall asleep, to let go of some of those thoughts. So fearfulness, fear of social situations, fear of any newness. So there's a lot of children that are going to be starting back full time soon. And when that happens, there does seem to be some anxiety or fear related to returning to a setting where you haven't been before, or there are some students that may have not returned to school since March and since last March, and they'd certainly need some type of reassurance or practice run or resources available to them just in case they're having trouble with returning to an activity that they were doing but they just haven't done, and they're worried about it. Fear of leaving home, fear of getting out of the house. So these type of social anxieties can present quite, they can present and limit things that they actually want to do. So they want to leave home, they want to go out and enjoy and meet their friends, but they're just having trouble because their anxiety is stopping them. Fear of separation, and then of course refusing to go to school. So treatment of anxiety disorders are treatable. You do want to talk with your healthcare provider or pediatrician. Cognitive behavioral therapies can work. Medication treatments sometimes need to be added as well. And treating early can prevent future difficulties. So it's very important to start to identify and treat early to prevent a wider gap or a harder treatment strategies. And early treatment can also prevent future difficulties such as academic or social difficulties and the self-esteem. So sometimes when children suffer from chronic anxiety or chronic inability to get out of, to try to do the things that they want to do, later on can cause them to suffer and decrease their self-esteem. And parent involvement is really, really important. So parents' involvement and accepting that this is the issue and trying to help them through, and having parent support is also very important. So what can parents do if you've identified some depression or anxiety in your child? So set the tone, try to be encouraging, try to be hopeful. Sometimes it's difficult if a parent is also suffering from some mental health illness, but it's really important to recognize that and discuss it and try to encourage help for your child. So listen to your child, really listen. Just be there and provide some support, give them that assistance that they need to find if they need treatments or if they need someone to talk to, support them. Just like someone with, I tell this to everyone, but especially patients and parents, just like someone needs blood pressure medication to help reduce their blood pressure, sometimes you need medication and therapy to treat anxiety and depression. So these things are treatable. They are something that you can get help for. And it's important to know that the treatments are effective and the treatments are necessary to help. It's not, you can't just will your blood pressure to get lower. You can't will your blood sugar to be lower. If you have diabetes, you have medications for those things. So there are medications that help us resolve our anxiety and depression. It's difficult sometimes to find the right medications and find the right therapists, but it doesn't mean that medications and therapy are not working. It means that maybe the specific medicine and the specific therapist may be not the ideal. Also, you want to make sure that you're doing everything else to make sure your body and mind stay healthy. So being active, go outdoors, exercise, make sure you're sleeping well, eating healthy. These are all things that help our mind and body, and then that can also help with mental health issues as well. And be supportive, listen, advocate, reach out to school counselors, school guidance, your pediatrician, healthcare workers. Everybody is trying to help as best as they can, and be an advocate for your child. Some other resources, again, call your doctor or your physician. They always have people that they can try to help set you up with. And they can also start the process, maybe do some lab testing, make sure there's nothing else going on, review family history. And there are some urgent care centers that I've been recommending. So of course, reach out to your doctor. I can't say that enough, but the Family Service League has a center in Hauppauge that is a 24-hour, 7 days a week urgent care center. I have some phone numbers for you later on in the slides, and they can help with any urgent matters. Cohen's Children's Medical Center also has an urgent mental health care center. They have certain hours. They're not open 24 hours a day, so they're Monday to Friday, I believe, and they have some evening hours. Stony Brook also has urgent care center and mental health intake facility for urgent matters. And of course, therapy, counseling, and these are all things that you can try to find the best person through your healthcare provider and through some of the resources. Some of the other resources, so National Alliance for Mental Illness, NAMI, they are a national alliance. There are local chapters, so there's a New York chapter, but there's a hotline that you can call if things get out of hand or things are somewhat of an urgent nature. That's the hotline number, and then if there's a crisis, you can text NAMI to 741-741. And if we're thinking, sometimes with major depressive disorder, we can have an increased risk of suicidal thoughts or ideations. And it's really important to recognize that that could be what's happening. And so we want to make sure that we have the resources available. The National Suicide Prevention Hotline is listed there, 1-800-273-TALK. And you can also text TALK to 741-741. There are a lot of resources available, and that is urgent if there is talk and planning of suicide. So that is something that we need to get help with right away. Again, this is the specific, the Dash Crisis Center. That's the one in Hauppauge. I just wanted to list the 24-hour hotline. It's there. And then there's the Pediatric Behavioral Urgent Care Center at Cohen's. You would just go to the Cohen's Children's Medical Center. And these are just some other references that, that I try to use. There are some websites. There's the American Academy of Pediatrics website that does have lots of resources. There's the healthychildren.org that I have referenced also. And this is, you know, I mean, this is very common, and it is really important to reach out if you're having trouble. There are plenty of resources, and there is help available. You're not alone. I think that's the most important part of this discussion, is that you're really not alone. We can find help for you, and I think that there are resources available. And we have to bring mental health into the norm of the discussions, meaning that it's not something that should be hidden. There shouldn't be any stigma associated with it. It's something that is there, that there is treatment for, and we need to get people the help that they need, and so that the issue doesn't become longstanding. And in our children and adolescents, it's important to note that it can present in different ways. So keep in touch with your doctor, and keep in touch with your children. Make sure that we continue to talk with them and listen to them, and making sure to identify any signs of symptoms that that we talked about. So I hope you found this helpful. Again, I wanted to thank the Elwood Public Library for allowing me to talk about different subjects, and I hope that everybody enjoys the day and find some of these resources helpful. And please continue to reach out if there's anything else that I can help with. All right, we're going to just stop sharing, and then, yeah, I hope everybody has great rest of the night, and please continue to keep in touch. All right, thank you.